Well, good afternoon. Today we are answering the anonymous questions. I think last class I told you there was like 29 or something. All of a sudden yesterday I go on, I'm like, oh, I wonder how many got. 49. Jumped almost double in just a few days. Hey, maybe what we were talking about last class, people were really interested in. I don't know. There's some good questions. I'm going to read them exactly how they were asked. So it could be a little funny. But I was a little disappointed. There were some questions that I get every single year and I did not get this year. So I printed out just a few past ones that I think are important. So I'm still gonna answer. Next class on Wednesday, I will be enabling your reproductive system test at the end of Wednesday around 2 o'clock. You know, there's a number of people who don't join Zoom from my classes, all my classes, and so they don't get like important info. So just want to tell you guys that now. Wednesday afternoon, it'll be open. Now, I have gotten some questions. That's right before break. When, are you going to give us more time? This and that. I always say, hey, listen, you're about to start break. Why not, our really long break we get, right? But why not get it done on Wednesday? Those of you who've been here, you guys are a really great class. You have all your notes for the most part, hopefully. You already know, you've been doing all of our assignments, you've been in class. This test should be simple, especially if you've been listening to me and writing down what I ask and getting those notes in. This test should not be difficult. It is timed 30 minutes. So those of you who have not really been, staying on task and doing what you need to do, you might be Googling answers, which you're not allowed to do. You might be looking through assignments, trying to find answers, and that's what's going to take you the long time. And then it's going to time out and you're not going to have time to do it all. So if I were you guys, those of you who have your notes, this class is a really good class, get it done. Then you don't have to worry about anything for my class for the whole break. Also, I would ask, and I'll remind you on Wednesday to put an alarm in your phone. Go into your calendar, write a calendar. It'll give you a reminder whenever you want to get it to remember to do it. Because if you forgot to do the last test from the nervous system, which is a 0, and then you don't do this one, you're going to fail the marking period. And it's on you. You will have until the 9th, not this coming Friday, next Friday. So you don't show up to Zoom on Wednesday, you forget about everything, you don't open your computer, you don't do anything over the break, you come back and then you're like, oh my God, I forgot. You will still have time to get it done. However, I will not be here for a while. I'm going to be out for a little bit. So what does that mean? That means there are no live Zooms. Yay. For you guys, it means you'll have a sub sitting here, but the assignments will still be from me. There's just no live Zooms. For you guys at home that are all remote, you're going to have this block of time that you're going to think you don't have to do anything, but there's going to be assignments still. So if you kind of take this time as your lunch or an extra free time, if you're home, you're going to get really backed up and you're going to have to get this stuff done, and it's not going to be good. Wednesdays are not asynchronous. That was a question I was just asked. Wednesdays are not asynchronous. They are synchronous, meaning there's Zooms on Wednesdays. And if our class falls on Wednesday, we have a Zoom. We don't learn anything new. We don't do anything new. But so yes, you will have an assignment every single class for me, whether it's a reading assignment, maybe the next class is going to be the actual assignment, and there's going to be things like that. It's going to be first aid. A lot of the information in that unit is going to be about first aid and burns and types of burns and stuff like that. So let's get into these questions. Like I said, I will ask these questions the same way that they were written to me. All right, here we go. So just heard myself. Okay. Should I use soap or Summer's Eve to clean my uterus? Okay, first of all, you can't clean your uterus. You can't reach your uterus. So I'm guessing maybe that question, the person meant the vagina. You should never, ever, 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 ever clean the inside of your vagina. That is called douching, to douche the vagina. That is very unhealthy. The vagina is a self-cleaning organ. You should avoid doing that at all times. It does not help you. It'll only hurt you because it can affect the balance of bacteria and the pH levels of your vagina, which can cause a lot of bad stuff, layman's terms, okay? You should also avoid any scented soaps or gels in that area as well. And depending on how sensitive somebody is, you know, it can affect people different ways. If my period is late and endometriosis runs in my family, could that be a sign of it? So endometriosis, the most common symptoms of that are pain and irregular periods. But just because you might experience those symptoms does not mean necessarily something's wrong or that you have endometriosis, okay? You should always just seek a medical professional if you feel that something is off. All of you, male, female, you all know your body is the best out of everybody else. So if something is off or different, you should always ask your doctor. I'm not a doctor. I am not a medical professional. I cannot answer these questions, nor will I, because I'm going to tell you, I don't know enough. You should always talk to your doctor about that. What is the pulling out method? Does it work even with protection on? The pulling out method is known, the correct term for that is the withdrawal method. What that means is if somebody is having vaginal sex with a penis, that they will pull the penis out of the vagina before they ejaculate or before they come, in thoughts that they cannot get the person pregnant if they pull their penis out before they come, right? There are many myths to this about people saying that they do not have to wear a condom if they pull out. Can't get somebody pregnant. Does pulling out lower the chance of pregnancy? A little bit, yes. Does pulling out help while wearing a condom at the same time? So if you wear a condom and you pull out, yes, that will really lower the risk of pregnancy. However, if you're not wearing a condom and you're having unprotected sex, there's still something called pre-cum, which is another question that nobody asked in all of my classes. I've always gotten the question, what is pre-cum? So I'm just going to answer for you guys anyway. Pre-cum is the liquid that comes out of the penis when a male is excited. And it's not ejaculation, it's not coming, it's liquid that comes out. What is it? It's produced by, we learned this, the Cowper's gland. If you guys remember, the Cowper's gland is not a part of semen, but it comes out before ejaculation to kind of clean out the urethra. Remember, because males pee from the same area that they ejaculate from. And so with that milky fluid that comes out, sometimes if there's any leftover sperm in the urethra from a past ejaculation, it can bring that sperm with it. And can some of that sperm be alive? There's chances. There's always a chance. So pre-cum is real. And I actually know a couple people who have gotten somebody pregnant from that. Well, not necessarily we know that for a fact, but they use the pulling out method and all that. But they were not using a condom. So, and you know, I'm always going to say it because it's true. The only 100% way of not getting someone pregnant or not getting pregnant is to not have sex. That's the only 100% way. You can be very, very safe using a condom, birth control, the pulling out, you know, whatever. You can be safe, but there's always still a chance. There's always a chance. How come some women have PMS symptoms after their period? This can be due to a surge of hormonal imbalances throughout the person's cycle. Sometimes it can happen more frequently or a lot worse for younger people since their bodies are still kind of figuring stuff out, like I've talked about before. However, it can also occur in adulthood. And one thing you guys are going to learn with a lot of these questions is it really depends on the individual person. It really just goes to show how different every single one of us are and how some of us can experience similar things, but some of us can also experience very differences of things. What is the average size penis? So it's not what we would think it is. It's not like the movies or TV shows or whatever. Same thing with sex, which was another question I didn't get. How long does sex last? Vaginal sex, which I will answer later. So the average size penis, erect or hard, is 5 to 6 inches. That's the average size. Flaccid or not hard is about 3.5 inches. All right. If the girl pees right after sex, will that kill the sperm? No, because it's a different hole. Okay. What is the name of the hole that girls pee from? I'll give you a hint. It's the same hole that guys pee from, the urethra. But what is the difference, and why is the girl's urethra not a part of the female reproductive system? Who remembers? Why is the urethra not a part of the female reproductive system? It is, but that's not the reason. When we learned the female reproductive system, urethra was not one of the terms, right? It was vagina, uterus, cervix, fallopian tubes, ovary, ovum. So how come the urethra was not part of the female reproductive system? It wasn't there because it's not part of it. The urethra is a separate hole. Females have 3 holes. They have a urethra, they have a vagina, and they have an anus. Males only have 2. They have a urethra and they have an anus. Remember, I talked about how the females are cleaner in a way, and we made a joke about how the urethra in males, that's why they have the Cowper's gland, to clean out the urethra before they ejaculate, to kind of clean out, because it's the same exact tube for pee as it is for semen, right? So it's a completely separate hole. How would somebody come out to their parents? I'm assuming they mean come out. Maybe they are part of the LGBTQ community, so this is a very personal situation. I cannot answer this for anybody. Just because I've come out twice in my life doesn't mean I know everything, right? And it can be difficult and it can take a lot of time. And I guess you'll just know when you're ready. One thing that I always tell students in anything, not just talking about this, but anything, you guys have help. You guys have resources. You guys have resources in this building that are free. And when you leave this building, they cost money. So you take advantage. You have counselors, you have a lot of help. And that's how I would answer that question. What is the purpose of the foreskin and why do people get it cut off? So I'm assuming this person meant the foreskin of the penis, talking about circumcision versus uncircumcision, which we've talked about before. There is no real purpose of the foreskin at this time of life. There's no real purpose. People get it removed because it's just an extra piece of skin that you really have to take more time to clean if you aren't circumcised. But like we talked about, there is no difference in function between a circumcised or an uncircumcised penis. What are the different types of sex? Vaginal, oral, anal, fingering or a hand job, dry humping, genital rubbing, masturbation. How does Plan B work? Good question. For those of you who don't know, Plan B is what a female may take. It's a pill after having unprotected sex. So you're an idiot, don't do that. Kidding. None of us are idiots, just don't have unprotected sex. What part of that pill is a hormone. It's called levonorgestrel. And depending where a female is in their cycle, their menstrual cycle, it can help stop ovulation. So if the female had sex and they didn't ovulate yet, what's ovulation? When the egg is released from the ovary. Remember, if there's no egg, you can't fertilize, there's no pregnancy, okay? So what this would do is it would stop ovulation from happening. It would stop the egg from coming out. It would, if the egg was already out and the female had sex, right, depending on the cycle, it would prevent the sperm from fertilizing the egg. And if the person took this late and the sperm already fertilized the egg, what this would do is it would stop and prevent the fertilized egg from attaching itself to the uterine lining. So if the fertilized egg isn't able to attach itself to the uterine lining, there's no pregnancy. And if you take it within 72 hours as directed, the earlier the better, can reduce the risk of pregnancy by 87%. You can still get pregnant even if you do take it. That is correct. Personal story, a friend of mine actually pulling out method, she had unprotected sex, pulling out method, and plan B, still got pregnant. True story. Is that rare? Yeah. Does it happen? Yes. Which goes back to the only 100% way of making sure you don't get pregnant or get someone else pregnant is to not have sex. Do periods still continue during pregnancy? Good question. The answer is no. However, pregnant women can still experience spotting and a little bit of bleeding, which can kind of seem like it might be a period. But obviously, this is all for a doctor. Seek a doctor if there's something off there. Can you get an STI from a blowjob? They wrote STD. That's the former word. STI from a blowjob. Yes. Just like any other form of unprotected sex, bacterial infections like gonorrhea and chlamydia can affect your throat. And skin-to-skin viral infections like herpes. And if a person has herpes down there, you can get herpes up here. Herpes type 2, which is genital herpes. You can get genital herpes on your mouth. Herpes type 1, which is known as the cold sore, if you guys didn't know. If you ever had a cold sore before, you have herpes type 1. It's actually very common. About 70% of the population has it. But because of the term herpes, people get all scared. You can get it from sharing a drink with somebody, from kissing. But I'm talking about herpes type 2. You can get herpes type 2 up here. So this was an interesting question, like they think I know or something. Does anal hurt? That answer is more personal and depends on the person. However, I will say, I'm just going to talk scientifically, right? Biologically, the rectum's membrane, which is inside the butt, is thin and not created for that type of activity. And it can be painful, can be pleasurable. That's just facts. When you have sex, does it hurt? It can hurt the first few times. Do girls bleed after they lose their virginity? Some do, some don't. That's mostly due to the hymen being stretched or torn. The hymen is a tissue that partially covers the vagina, and some people have it, some people don't, and that's why somebody could bleed. Is it normal to shave genitals? Sure, or not. Personal preference. Many people do, some people don't. Personal preference. When do guys stop jerking off? I don't know all guys, so I don't think I can answer that. But hey, if they're 90 and it works, why? I don't know. Can you get pregnant while on your period? Yes. Yes, 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 yes. Lower chance of it? Yeah, lower chance of it, but you definitely still can. Remember we talked about how 1 month, the release of the egg, the ovulation happens from one ovary, and then the next month the other ovary, and it kind of goes back and forth. Well, if one ovary is on a shorter cycle than the other, it can release. And sometimes at younger people's ages, sometimes you guys will ovulate more than once a month. And it's really, again, body's trying to figure stuff out, right? This was an interesting question. Is there a difference between boy sperm and girl sperm? No, because there's no such thing as girl sperm. What if 10 sperm cells meet the egg at the same time? What would happen? One sperm can only enter one egg. How are twins made? That's a great question. So identical twins. Identical twins is when that fertilized egg starts to divide. It'll split into two. That's identical. And then they divide on their own, and they're two separate humans. So why didn't you ask, right? Fraternal twins is when there are two eggs, and this is genetics. So if a female ovulates, and we always talked about the female ovulates and one egg comes out. Well, sometimes two eggs can come out. And this happens more frequently, but just because two eggs come out and you have unprotected sex, let's say you're older and you're trying to have a baby, doesn't mean you're gonna fertilize both of them. In order to have that, you have to have two sperm find both of those eggs and fertilize both of those eggs. But if so, that's a fraternal twin. Now, in rare cases, you get the fraternal twins, right? Fertilized egg. Now that one of them starts dividing and that one splits into two. So now you have identical and a fraternal, it's triplets. What if you have fraternal twins and then this one splits into two and this one splits into two? Now you have quadruplets. That's how that could happen. Or someone ovulates 3 times or 3 eggs and then they each get, right? There's all these different combos. But it is genetic. What if a girl doesn't get their period and they are not pregnant? This can be due to many different factors. Obviously, younger people can have irregular periods and cycles. They can skip periods while their bodies are still trying to figure stuff out. But I would say if this is your personal body and it doesn't seem right or it seems off, you should always talk to your doctor. It's the exact question. I'm just reading what I got. When we jerk off and we nut, is it supposed to make your leg numb? So I'm just going to get technical here. After ejaculation, your body can become very relaxed or tired. All of the blood flow kind of goes to the genital area and can cause muscle relaxation, can cause tingling. It could do that. I would say, though, to make sure this is something that you discuss with your doctor. And if you guys are not comfortable talking to your doctor, or you don't even have a doctor, you don't go to a doctor, especially at your age right now, you really should start seeing a doctor and talking about this stuff, even though it can feel uncomfortable. It's patient, doctor-patient confidentiality. And it's good to know any questions you guys have. Vaginal discharge. Does discharge have anything to do with periods? And could you explain where discharge comes from? So vaginal discharge is very common in women who menstruate, who have their periods. It's a way that the female's body gets rid of fluid and cells from the uterus, cervix, vagina. During ovulation, the discharge can be thicker. This discharge can be sticky, clear, or white for a healthy discharge. There's a slight odor, not too strong. It can leave a yellowish tint. The changes in the consistency really varies on the individual cycle, but you should talk to your doctor if there's any changes, appears yellow, green, gray, has a strong yeast or fishy scent, or is brown or blood stained. Any type of differences that happen with your bodies, like I said, you should be talking to your doctor. But all in all, vaginal discharge is completely common and normal. Sometimes when I see someone kissing, my penis becomes bigger and it releases a milky fluid. Why does this happen? Well, buddy, you have been sexually stimulated, which will cause an erection, which is what happened. The milky fluid is the fluid from the Cowper's gland, like we talked about earlier. Completely normal. If a man decides to change to a woman, can they have kids? I hope I worded this right. Okay, yes, I guess, right? So if a trans person, they still have the reproductive system that they were born with, so they still could. However, some trans people will take hormones and their reproductive system can be greatly affected, which can cause the eggs or the sperm to not function, but it is still possible. Why is it bad to have sex at 15? I'm not your parent. That's a personal decision. I'm not going there. How do abortions work? So there's a numbing medicine that goes into the cervix. The cervix is then dilated and stretched. They insert a thin tube into the uterus with tools and a suction device to remove the pregnancy tissue out of the uterus. What is an orgy? Multiple individuals participating in sexual activities together. What hole does the penis go into? Well, technically, a penis can go into any hole, right? I don't know. But if you're talking about reproduction or having vaginal sex, the penis goes into the vagina. Does jerking off more reduce your stamina in bed? No. Last class, you told us that you were going to be transitioning. If you don't mind, I have a few questions. What exactly does that mean? Like, are you planning to surgically switch genitals? Wow, that's intense. And what do your wife and kids think about it? Well, we're getting personal, aren't we? So I thought about this and I'm like, I'm not going to answer this, but let me just ask you guys, okay? So I've always had, cis male teachers. What's a cis male? We learned this before. Does anyone remember what a cis male is, Tom? So yes, okay. So that means that you identify as the gender that you were assigned, right? So if somebody was assigned male at birth and they identify as male, right? Just cis male, right? So as students, right, you guys don't go up to your male teachers and ask them what's in their pants, do you? You don't. That'd be like inappropriate, right? And kind of weird and uncomfortable. So honestly, and I'll talk about in general, you don't ask people about what's in their pants, whether it's your parents or your friends or your teachers, or you just don't do it. So just because somebody is trans doesn't mean you can ask them about what's in their pants too. And also what's really important to remember is that there are some trans people who do surgeries to 100% look like the male identified at birth, right? And there's some trans who don't do anything. There are some people who take hormones, and there's some that don't. So I can really only talk about myself, which I'm not going to give you that answer because that's a little weird and inappropriate. So we don't have to go there. I will be taking hormones eventually, if you guys want to know that. But yeah, that's that. Hope I answered your question, whoever that was. What age does a period usually regulate? That's a really great question. So I can't really say what age because females get their periods at different times. Periods can start as early as 8 years old and as old as even 16 years old for the first time. So depending on like when you get it, I'm not going to give you an age, but this can take a few years to regulate, sometimes 3 to 4 years to regulate. And even so, as your body progresses, and I would definitely say you should be seeing a doctor. You should be seeing an OBGYN, especially if you're sexually active. You should be seeing a specialized doctor. All right. So those are all the questions I got from this year's classes. There were some questions that I didn't get that I thought I would get. So I'm just going to answer some of these. All right. How does a condom prevent you from getting pregnant? Good question. Condoms are made from very thin latex rubber or polyurethane or polyisoprene and are designed to stop male semen from coming in contact with their sexual partner. Okay. When used correctly during vaginal sex, they help protect against pregnancies and STDs. If you use them perfectly every single time, perfectly, 100% perfectly, then they're 98% effective. But by perfectly, I mean, are you putting it on correctly? Do you know how to put a condom on correctly? Right? But people also aren't perfect. So in real life, condoms are about 82% effective. Still pretty high, but still about an 18% chance, right? So about 18 out of 100 males who use condoms as their only method of birth control will get a female pregnant each year. 18 out of 100. All right. Another question. Can swallowing cum get you pregnant? I thought this was funny, so I'm adding this in. So no, swallowing cum is your digestive system, not the reproductive system. completely different. And swallowing semen is digested the same way that food is. There's no health benefits, but if you need to know, there's about 5 to 7 calories per teaspoon. Why do pregnant women not drink coffee or caffeinated drinks? So, caffeinated drinks and coffee are stimulants, and stimulants increase your heart rate and blood pressure, which are not recommended while pregnant and can lead to lower body fluid, dehydration, and pass to the baby. There are some people that might drink coffee once a day. I know that there's like an amount that is safe that they say that women can drink. Why does it feel good to ejaculate? Dopamine is released from the brain. If you guys remember, we talked about dopamine long, long ago, and it's that happy hormone. And this is a question I really thought I'd get. I get it every year. How long does sex usually last? Vaginal sex, in this case. So sex is actually a way shorter period of time than many people think. The average is about 6 to 7 minutes. 6 to 7 minutes, but almost 50% of males within 2 minutes. And pre-ejaculation, which means a ejaculation occurs earlier than they want, happens around 30% of men. It's a pretty high amount. The desirable time, 7 to 13 minutes. All right. So I hope you guys got something out of today. And yeah, I hope you guys learned something. I was a little kind of bummed. I didn't get a bunch more questions, but hey, it did jump from 29 from like end of last week to 49. So I did get like 20 extra questions within just a weekend. So something sparked the question. So again, on Wednesday, we're going to have a review, and that review will be available all week till the end of next week. That review will include the diagrams as well as the as questions that might be similar that you can help kind of review for your test. We're going to be doing that on Wednesday. Also, keep in mind, so your test is going to be multiple choice, true and false, open-ended, some matching, and the diagrams. And if you don't have the notes, and if you haven't been taking the notes, again, check out the guides folders. If you need to, check out any, recorded Zooms. But you're not going to have enough time if you don't have any of those notes to answer all of these questions correctly and get a good grade. Remember, it's a 30-minute timed test. If you guys don't have any questions, Zoomers, you are free to go. Have a great day.